Kogi State Governor Ahmed Usman Ododo says his administration will establish additional 63 primary healthcare centers across the 21 local government areas of the state. Governor Ododo revealed this during the flag-off and commencement of free health insurance scheme under the Basic Healthcare Provision Fund in the state. Governor Ododo said the provision of additional healthcare centers will improve healthcare delivery in remote areas across the Confluence State. Our reporter Faith Abdul Ghaffar has more.
Supporters of the renewed hope, joined by beneficiaries of the state free healthcare program, converge in large numbers to celebrate the continuity of good governance. The Secretary to the State Government, Dr. Folashade Ayo-Ade, commended the government for the initiative. She explained the benefits that are bound in registering with health insurance schemes at the national and states.
I've been a civil servant at the federal level with National Agency for Food and Drugs Administration and Control. I worked with NAFDAC for almost 30 years, and I enjoyed the health insurance. I enjoyed it, myself, my husband, and my 4 children. In fact, it got to a point that I had to ask the accountant in my office then, that are you sure we are paying for this health insurance thing? Because I couldn't feel it in my salary. And we're going to the hospital, we were being treated free, initially anyway. It got to a point we're just paying 10% on the drugs. We go to the hospital, even with surgery, antenatal, postnatal, we're having it free. I need to let you know that is something that is very good.
The State Commissioner for Health, Dr. Adams Abdulaziz Adeza, said that the launch of the Access to Healthcare program in the state will mark the end of out-of-pocket expenses for the healthcare in Kogi State.
It is to the benefit of Kogites and residents of Kogi State. Let me bring it down for us to understand health insurance. One person working as a civil servant of the state, be it the man or the wife, will take care of the other, if it is the other one, and 4 of their children. You go to hospital to access basic care without dipping your hand in your pocket to pay for those services. Because a token you have contributed from your monthly salary. This takes care of these 6 persons in the family. Health insurance has come to help us achieve universal health coverage in Nigeria. It was established to bring health care to the doorstep of every Nigerian, so that the burden of out-of-pocket payment in our hospital be taken from us. Health insurance has come to ease our concern whenever we feel ill and we're afraid of going to the hospital because our monthly salary is not due yet. It is a bit stressful on the part of the government and also on the part of the health insurance agency. But yes, as health institution, we are ready to take the burden for all of us because we are here today to serve Kogites and residents of Kogi State. That is the mandate God has given to us. And by the special grace of God, we will do that to the best of our ability and to the service of Kogites and residents of Kogi State.
Earlier in his remarks, the Executive Secretary of Kogi State Health Insurance, Dr. Aledere Adekule, said Kogi State has made a good start in the journey to universal health coverage. UHC, with over 100,000 Kogi citizens who have already been enrolled in Access Healthcare Services program in the states.
We will continue to implement our key strategies as documented in our 10-year strategic plan to achieve 60% coverage of our population in the next 10 years. I have the firm belief that the launch of the formal sector health insurance plan today will provide a strong foundation for us to rapidly scale up our informal sector population coverage. Formalizing the informal sector is a key strategy that can fast-track informal sector participation. Today, as we proceed in this event, history will be kind to us that we are gathered here to provide hope to our civil servants and their dependents through the formal sector, which has the propensity to reduce financial burden associated with paying out of pocket for health, particularly in the face of rising medical inflation. This bold step being taken today makes Kogi State the third state in the North Central states to commence the formal sector plan for their employees. Kogi State Insurance Agency carries the moral burden of accelerating the attainment of universal health coverage in Kogi State, and we will continue until no one is left behind. The vulnerable population in the state have continued to enjoy access to free quality healthcare services in the state through the Basic Healthcare Provision Fund of the federal government and the Complementary State Equity Program, also known as Bello Care, which both currently provide support to about 45,971 enrollees in the state across the 21 LGAs.
On the part of the civil servants in the state, the organized labor and the head of the civil service are sure of their support.
A week ago, I said you have done well. Today again, I want to say you have done very, very well. Just like the Executive Secretary has narrated to us, this journey started about 4 years ago. Many thought it is a project that will not see the light of the day. Many said that it is the workers, the labor, that doesn't want the project to commence. I remember one of the component projects of this scheme was launched here called Bello Care. I represented the worker, and I do say that the workers are ready. We have resolved to be part of this project because the little couple we contribute, we go a long way there to assist the vulnerable. That we are very ready. But our fear is that hope government will be faithful in their 5% contribution. But to God be the glory. Today, even the formal sector deduction has not started, but the state government has paid up to 9 months. This is not just hearsay, it is what I have seen myself. The Executive Secretary has done well by organizing series of lectures, series of seminars with organized labor, which will in turn go back to enlighten our members out there. We have seen that this scheme is a good one for the workers of Kogi State. Your Excellency, one thing again that ginger us that this project is a nice one is that in the course of our sensitization, we made to understand that Kogi State Health Insurance Agency has no middleman, the one they call HMO. Those are the ones that brought problems. That's why when you go to your facility, you don't have drugs. They are dealing with the health facility directly. That's to say, we are sure of facilities that are not performing can be dropped at that level. So, and at the same time, we're only told that they pay their capitation even upfront. So what will stop the health facility from giving us the necessary services? Sir, I want to say on behalf of the worker of Kogi State, we are ready to partner with you. We'll continue to pray with your government and you'll continue to succeed.
Health is wealth, and God is using you to kickstart this program in this state. I want to assure you that on behalf of the civil servants, that we have accepted this program and we have fully keyed into this program. And we pray that as you have started this program, in less than 2 months of your administration, God will continue to be with you and strengthen you. And I want to appreciate the organized labor for signing the agreement on behalf of civil servants less than 2 weeks ago.
Key leaders from the National Health Insurance Scheme were present They also commended the state government for embarking on the laudable initiative.
We see health poverty as a problem in our land because, on one hand, it means that those who do not have the pockets to pay will not have access to healthcare. On the other hand, it also means that those that can pay, when they are hit with a very serious illness, can fall back into poverty. One of the strongest defenses we have against that is health insurance. So you must understand why today I'm particularly excited that today marks a turning point of bringing Kogites out of health poverty by just this example of leadership that His Excellency has put in place. I'd like to say that this action is in alignment with the objectives of achieving universal health coverage. Universal health coverage is one of the top priorities of many countries. It's also top of the agenda of His Excellency, the President of the country, Ahmed Tinubu, GCFR, as part of his renewed hope agenda. This has also been articulated by the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who as part of his health sector renewal investment initiative has earmarked universal healthcare coverage and expanding health insurance coverage for Nigerians, bringing them out of health poverty as one of the key pillars of his agenda. Your Excellency, these comprehensive endeavors underscore the state government's concerted efforts to bridge existing gaps in healthcare access, particularly among various segments in the state. In essence, the multifaceted initiatives from the various schemes that we have highlighted epitomizes Kogi State's resolute commitment to leveraging all the different fiscal space opportunities that we have to expand healthcare coverage and prioritize the health and well-being of all its citizens.
You have taken the bull by the horn, continuing from where your predecessor stopped, embarking on this kind of expensive venture, knowing fully well, precisely as an auditor, what you're going into, knowing the Naira sign in front of your commitment today is very, very heartwarming. Congratulations. I congratulate the civil servants of Kogi State for having this kind of initiative happening at this point from a man who understands the Naira and dollar sign to make that kind of commitment. It is a good day in Kogi. For us, in the forum of CEOs of state social health insurance schemes in Nigeria, which at this point my colleagues have elected me to, by privilege, chair, I congratulate you, sir. I have a message clearly for the beneficiaries. All that the agency has promised, they need you to be the watchdog. When you get to the facilities and those things that were promised you are not happening, reach out to them on their call numbers. If you do not do this feedback mechanism, they will not serve you well. What has made societies outside this climb to work is that when people see something, they say something. But here, when we see something, we rather will complain that government hasn't done this, government hasn't done that. This level of goodwill demonstrated today by this governor, your own part will be to get to the facilities, and when things are not going right, reach out to the agency.
They said healthy people translate to a wealthy nation. The state governor Ahmed Ododo commended President Bola Ahmed Tinubu for his unwavering support towards ensuring Nigerians have equal access to health care through the provision of funds to cater for the well-being of the people under the renewed hope agenda. He equally commended his predecessors, the ex-governor Yaya Bello, for his initiative to set up the Kogi State Health Insurance Agency.
This is a test to we, the younger generation, and we must prove ourselves beyond reasonable doubts. We are committed to serve our people to the best of our ability. Mr. President, sir, you have shown trust, confidence, and belief in the capacity of the younger generation, and this has provided a stable platform for the people of Kogi State and the government to deliver good governance to our people. We have no reason, we have no any reason for whatsoever not to deliver to the good people of our dear state, because Mr. President has shown his support. Mr. President believes in the younger generation, and through his agenda, His Excellency, the former governor of Kogi State, has laid a very, very solid foundation for us to ride on.
The governor said that his administration will continue to consolidate the achievement recorded in the health sectors across the 3 senatorial districts of the state.
We thank His Excellency for taking this bold step, for laying this solid foundation for us to ride upon, and we have promised to build and consolidate and continue with his achievement, and this is one.
The state health insurance scheme was launched to cater for over 32,000 beneficiaries in the former sector's over 41,000 basic health care provision funds, and 10-year strategy plan of Kogi State Health Insurance Agency 2024 to 2033 to achieve 60% coverage of the state.
Inadequate access to finances is largely responsible for the challenges in accessing quality healthcare among households in Kogi State and by extension across the nation. The rising cost of healthcare services due to the prevailing high inflation rate in the country is further pushing more people to health poverty. This is what we have said to address. Provision of health insurance is only a way to reduce out-of-pocket spending on health among our people. As a responsible government, we have decided to launch the formal healthcare insurance plan for civil servants in the state and the basic healthcare provision for vulnerable persons in the state to advance the healthcare needs of our people. Providing health security to our civil servants will no doubt improve productivity and boost economic prosperity in Kogi State. As they say, health is wealth, and a healthy community will lead to increased productivity. This is what we have set to achieve, and as a Kogite, we have all resolved to work as one united family to greatest and to the benefit of our people.
He presented some registered beneficiaries' plans of proof to have direct access to medical health care. In attendance was the Megiri of Lokoja and other traditional rulers. I am Faith Abdugafar, reporting for MFC TV.